Hello, I am Dr. Vijay Raghavan. Let's discuss functional disorders of parathyroid gland. Is often asked theory questions in your examination. Obviously, there are two types of functional disorders, hyperparathyroidism and hypoparathyroidism. Now, hyperparathyroidism is further classified as primary, secondary and tertiary. Primary hyperparathyroidism, obviously the disease is in the parathyroid gland. The secondary type is secondary to continuous hypocalcemia or hypovitaminosis D of any reason, stimulating the parathyroid to secrete more to compensate for the hypocalcemia. When it comes to tertiary hyperparathyroidism, we are talking about a patient who has had secondary hyperparathyroidism for a long time, and the hyperparathyroid continues even after correction of the primary disease which led to secondary hyperparathyroidism. Like it is like hyperplasia of the parathyroid gland for a long time, slipping into an adenoma or neoplastic disease which is beyond the control of calcium hemostasis. So a patient continues to have hyperparathyroidism even after correcting the cause for hypocalcemia. Now, the classical features of primary hyperparathyroidism is calcium is high, phosphate is high, and serum parathormone is also high. See, the high calcium or low phosphate should reduce the parathormone level. So, if the parathormone also remains high in spite of calcium high and low phosphate, it is a primary hyperparathyroidism. So, what are the causes for primary hyperparathyroidism? Parathyroid adenoma accounts nearly for 85% of the time. Hyperplasia of the gland can lead to primary hyperparathyroidism. Malignancy of the parathyroid or malignancy of other tumors which mimic hyperparathyroidism accounts for less than 1%. You have to remember multiple endocrinal neoplasia group called MEN1 and MEN2A. They can contribute to the cause for primary hyperparathyroidism. Like in MEN1, you have a pituitary adenoma, pancreatic islet cell tumor with parathyroid hyperplasia or adenoma. In MEN2A, it is a combination of medullary carcinoma thyroid, pheochromocytoma and parathyroid hyperplasia or adenoma.